Good morning and thank you for joining us today. Teresa Marintet is working from home, and my name is Dr. Rajat Ahmed. I'm the Medical Officer of Health for Windsor-Essex County Health Unit. Over the weekend, the province reported more than 2,000 new cases of COVID in just 2 days. This is concerning to see that the number of cases continue to increase, posing a significant risk to all Ontarians. At the same time, the Windsor-Essex County Health Unit reported 13 cases in total for Saturday and Sunday. Today, we are reporting 1 new case of COVID-19 in our region. We must not take these numbers lightly and really focus on the prevention. In our region, we are not seeing the same increase that the other regions are seeing and experiencing, and it can be attributed to all our community members and our businesses who want to make sure that they provide a safe environment for their customers and continue to stay open. I want to request all of you to please continue to follow all these measures to keep our case counts low and keep our communities safe and continue to move forward. What we are noticing in our community is truly a reflection that public health measures are working, and please do not let anyone tell you otherwise. Any false information that makes people question these public health measures is a complete disservice to our community and could potentially lead us to a situation with wide-ranging impacts on everyone. Please remember that the surge in cases in summer happened at a time when not all our businesses were open, our schools were closed, our colleges and universities were closed, our hospitals were not doing elective procedures, and you can imagine the magnitude of the surge if it happens now in our community. It can easily devastate many sectors, businesses that are currently recovering, our children's attending the school, our hospitals that are working really hard to clear the backlog of cases. Please make no mistake, there are much bigger things at stake with second wave, especially when everything is open, and any uncontrolled spread can easily get out of the hand and spread everywhere that is currently open, such as workplaces, schools, places of worship, hospitals, etc. We are already seeing the evidence in other jurisdictions that how each of these places are impacted by COVID-19 transmission. I therefore literally beg you and request all of you to please do not lose your guard, do not listen to the misinformation, and focus on the goal of keeping our community safe and free from COVID-19. We can do it, and we can decide what our future should look like. Things doesn't happen with just saying this is what I want. Things happen when we start saying, what do we need to do to keep ourselves safe and live the life the way we want to? Thank you.
The conference is now unmuted.
We'll now take questions from the media. Is there any questions from CBC?
No questions.
Any questions from the M800?
Dr. Ahmed, just today's case, is it close contact, community? What can you share with us?
Right now, it's under investigation. As you know, Sundays our team work half-time, so we'll be on top of the case details. We have very limited information at this time.
Okay, thank you. And then a question in regards to this past Sunday's rally that happened. I'm just wondering, why wasn't there more enforcement? The reason I ask that, is that more the health unit? Is that more Windsor Police? Is that the city? Because if someone throws a party in their backyard and there's more people out there than there's supposed to be, the cops are called. When it comes to rallies, who's enforcing those?
So typically, these type of measures that are clearly identified under the Reopening Ontario Act, it gives the authority and power to the police and the bylaw officers to enforce and implement all those policies and procedures. And any violation falls under their domain. We work very closely with our police partners, and we were in consultation with last week to make sure that we have everything in place. With respect to any violation or charges, I would defer that question back to the Windsor Police Services because technically that's in their jurisdiction to mandate and enforce.
I guess just on that point, are you disappointed? It sounds like there was no charges, fines laid. I saw pictures obviously on social media and looks like there was a good amount of people out there and not following all the safety measures that have been put in place by your team, the province. Are you disappointed that we didn't send a stronger message to those that were disobeying these safety measures?
I can't speak to the specific situation, and I guess the police were on scene, and I'm sure that they were monitoring it very closely. So I can't really speak what happened and what didn't happen, and they will be in the best position to answer that question.
And one more, Dr. Ahmed. I guess for you at this rally, a couple of the organizers said they have reached out to you, they want to talk to you. Have you ever got a call from them, an email from them that they want to, I guess, sit down with you and talk to you about, I guess, their concerns?
Not to my knowledge that I have denied any of these requests, but what I can tell you is obviously I get lots of requests, lots of people, and I'm only one person and my time is limited. So it's really, we are an agency with more than 240 employees, and we all have different expertise. Most of these questions are addressed and answered by my team, and any critical question that my team cannot answer, they definitely bring it to me, and then we try to either I answer or we collectively come up with an answer. What I can tell you is, I'm always available. You guys are there to ask all of these questions, and I even took some of the questions in the media in my YouTube briefing in the past as well, and I can continue to address those questions. And I think what matters is some of these people, they're not looking the answer that they're getting from me. The answers are out there. It's very clear. There are a number of issues that are there. It's basically just saying that if my answer doesn't satisfy them, I don't know what else. But I'm here. I connect with everyone regularly, and this is we're doing since March, and we'll continue to do that. We have never backed out of any of the conversation and discussion, which is productive and which is meaningful, and we'll always be there.
Thank you.
Any questions from Windsor Star?
No, thank you.
Any questions from Blackburn?
Yes, good morning. Over the weekend, the Chatham-Kent Public Health Unit announced a exposure at a blood donor clinic, and our reporters reached out to Canadian Blood Services, and they told them that they are working with the Chatham-Kent Health Unit along with the Windsor-Essex unit. Is there a reason they're working with the Windsor-Essex unit? Was there a blood donor clinic locally that an exposure may have happened?
We'll have to look into all of these cases. There are sometimes, because of the jurisdiction, some people work in multiple settings, so there may be some other issues that needs to be addressed. I don't have that detail at this time, but what I can tell you is obviously there may be some prevention aspects, some IPAC aspects that we need to look at, and to make sure that everyone is following all those measures.
So no exposures that you're aware of. You're just working with them to make sure one doesn't happen in the future.
That would be accurate. I think what I am aware of is that someone who attended that clinic, and then there may be other contacts identified. How it impacts my community, I don't have that details at this time.
Okay, thank you.
Any further questions from CBC?
No, thank you.
The M800?
Dr. Ahmed, going back to your comments about asking the community to obviously continue to follow the safety measures, we don't want to see a spike here in Windsor-Essex. Has there been any whispers with the ministry that to step the whole province back instead of going certain regions like the GTA, Ottawa? I know London's health officials did their own, but has there been any whispers, any talks about just shutting it down to a restricted stage 2 for the entire province?
Not to my knowledge. I'm not involved in any of those conversations, but obviously I think I would support some of these things that we have done in the past, and some of those measures were put in place because there were a lot of things that were evolving at that time, and we needed to have a better handle on what's happening and how we can keep everyone safe. At this time, what we can say, at least in Windsor-Essex, is any changes that it should be discussed with the local health unit, and some of these conversations happen. We definitely report any unexpected increase in the number of cases back to the province so that they have a better picture of what's happening locally. And we want to continue to work with them. At this time, I haven't heard any of those conversations, and we hope that things, if the province makes such decision, it should be based on the evidence and local epidemiology. And some of these measures, if it has like a wide-ranging impact, I think that definitely should be discussed.
Thank you. Have a good day.
Any further questions from Windsor Star?
No, thank you.
Blackburn?
No, thanks.
Thank you, everyone.
Thank you.